Hello guys, welcome back to our YouTube channel. So today I'll be taking a life of a medical student here in Iran, Tehran. So today we'll be going to Imam Khomeini Hospital located here in Tehran. So yeah, today I have infectious ward. So follow me to see the life of a 50-year medical student here. And so before we go to the hospital, let me explain something. So as a 50-year medical student, you are in the clinical stage, and so usually when you are posted to a ward, the first thing you have to do, first thing when you go, you have to know who your patient is. So usually you are being grouped into either 2 people, 3, 4, 5, maximum I think 6 people. So the first thing you do, you have to coordinate with your colleague when you go there, choose the patient. So it depends on the amount of patient you have. And sometimes they are a little bit less, sometimes they are many. So usually like this. So in here we have already chosen all our patients, and we are looking through the patient's medical file records before we go and take the history ourselves, so that we get it ready. And when the doctor comes in, we have to present it to her, because the doctor doesn't talk to the patient first, she talks to you first. So you have to present it to the doctor, and she makes her judgment and asks questions that's been needed. So here I ran into my Nigerian colleague. He's an intern there, so I'm here to take this patient's history. So yeah, he did help me with taking it, and we did it together, and yeah. And after this, I have to go back to the nurse station there and take the patient's lab values, since usually each day you have to take lab value, because for the blood and other lab values that's been needed. So yeah, and then check whether there's any radiological findings, maybe either sonography or chest x-ray or CT scan, anything that has been done to the patient. You have to check and see the result and get it ready, so that when doctor comes, you present. And here we have the doctor. She just came in around 10 a.m. and yeah, the staging has finished presenting the patient to her. And here we are going to go through the patient's medical prescription and see what needs to be increased, what needs to be reduced based on usually the patient's lab values and his general overall health condition. So if there's something that dosage needs to be increased, will be increased. If there's a drug that needs to be cut down, it will be cut. And if there isn't a need for a new drug, she will decide. She makes the call there. We just listen, since we are just students there. Yeah, she's examining the patient to see if there's any other problems. Like here, she's examining his, I think, grip. Yeah, it's the grip. Yeah. So and she makes her judgment based on what she finds and the lab values and other findings. And yeah, that will be it for the patient for now, till the next day after this round. The next thing, we just write it down, and usually the nurses, they usually follow up the drug prescription, because I've never seen a doctor in here follow prescribing the drugs, and they usually write the prescription, write it down there, and usually the nurses usually follow that up. They are really doing a good job though. Yeah, she finished writing everything and signed, then leave the patient file there for the nurse to come and take over. I've already did my own patient presentation. That time I was not recording, so you hardly see me. This is, I think, the 5th or 6th patient, I think. And then one more to go, and we're not out. Then we have another thing to do. I think presentation of a research paper by topic. Usually she gives one topic every day to one student. So if it is your day, you'll be the one presenting. So yeah. So here we wait to go to the second room. not the second, I mean the last patient. And yeah, yes, my colleague coming. So I was trying to hide, but then she saw me, so there's nothing I could do. Okay, yeah. So this was our last patient, and yeah, this stager, I mean the clinical student here, is usually presenting their patient's findings to the doctor. And the doctor wants to confirm one issue with the resident that was with the patient earlier. So she asks us to call her, but she's a female, so here she is. Yeah. So they discussed for a while. Okay, then we're already done with the rounds, and here we are in class. So the student that was given the research to do it has to present it to the doctor. I think his own research is about relation of hypokalemia in COVID-19 patients. What is the relation? What is the risk? And what is the treatment? So you have to, like, if you are given a topic, you have to go look at research papers, summarize it in your own language, then present it to the class. And well, if there's additional things she wants to add, she usually add it and correct it. Then we just call it a day in the hospital. And after that, I think we usually have class, which is either, it's usually like two options. You can either choose to stay offline, go in person, or you can choose to join online. So well, there are some students that usually go in person, but we usually prefer to go and do it at home, in the comfort of your home. So yeah, we are done presenting that, and yeah, we are going to the pavilion to remove our lab coat, dress, put on our winter jackets, and bounce home or go to the cafeteria, because it's kind of cold, and usually when you are in the lab coat, if you're not inside the hospital, inside the ward, it's usually freezing cold outside. So yeah, you just go back to the pavilion and get ready and wait for the online class to start. And after that, I think usually the class takes 2 to 3 hours or 1 hour, like that. And usually after that, we call it a day then till the next day. And usually, our rotation usually starts on, because here the week starts on Saturday and ends on usually Wednesday, but usually Thursdays we do have hospital rotation, and some doctors do allow students to go off on Thursdays, while some won't allow you. So it depends on how lucky you are. So yeah, this is how it is. Yeah, when I really like the hospital, it's a very big and old hospital, and there are a lot of new constructions going in, increasing the capacity, and that's some good thing.